Hello, everybody. Welcome to another Holistic Health Hour. I'm Dr. Kevin Connors, where we do our best here to try to answer as many questions as you might have. I'm going to start off with some questions that were submitted on the holistichealthhour.com, but you're welcome to chat in questions as well. Remember, you can go to holistichealthhour.com and you can see all our past episodes, and they're very nicely indexed if you have any specific questions that we may have already addressed. We've done a lot of these, and I've done a lot of blog posts too. So if you need to, don't find something on there and you want something, an answer to something, you can look at our website, Connors Clinic, CONNERS Clinic.com, where I have, 1,500 blog posts or something like that. Many of them have videos and good explanations of what you might be searching for. Also, I want to introduce people to our courses. If you don't know anything about that, our autoimmune course is extremely helpful if you have a chronic disease, Lyme disease course, detoxification course, and of course, our cancer course. All right, let's jump into these questions. First question, I've been nebulizing daily with hydrogen peroxide and a saline solution for lung metastasis. So this person has cancer with metastasis to the lung, and recently purchased colloidal silver to nebulize with as well. Do I use two separate nebulizations, or can peroxide be combined with colloidal silver in the nebulizer? No, I'd say do two separate sessions with the nebulizer. I mean, they only take 10 minutes or so. So I would do two separate sessions, and I would separate them by a few hours. They have different benefits, and when you're using hydrogen peroxide nebulized, you should always use the formula that we have on our member site. It's a formula that Dr. Mercola published, a PDF of that formula years ago. So you have to use food grade hydrogen peroxide diluted to a specific formula. So you don't just do hydrogen peroxide nebulized. So, and the purpose of that is that hydrogen peroxide is an oxidizing agent. It can kill bacteria, it can kill fungus, it can kill viral infections in the lungs. And as an oxidizing agent, it can also help kill cancer cells. Colloidal silver is a totally different substance. It is not an oxidizing agent, if I remember correctly, but it can be an antiviral, antibacterial. It can have those properties as well. So I would do those separately. Okay, next question came in. Are there any supplements that can be taken to enhance the effects of high-dose vitamin C infusions? I'm doing 50 grams. Are there any supplements that should be avoided when getting these infusions? There's no supplements that you really need to support that, or that would enhance that. So why would a person get an infusion, an IV of 50 grams of vitamin C? Well, the main purpose of that is vitamin C in high doses like that actually acts as an oxidizing agent. So normally, vitamin C in normal doses of consumption of foods, you're eating some greens or citrus fruit or something like that, you're getting a dose that acts as an antioxidant. So vitamin C at normal food grade food consumption doses is an antioxidant. So understand the difference between an oxidant and an antioxidant. So things enter our body through foods, through breathing in toxins, through ingesting poisons and such. And those that are oxidizing agents, that are toxins to our body. And oxidizing agents in too high of a concentration can damage cell membranes, can damage the nucleus of the cell, can be causes of cancer. And one could argue that oxidizing agents are possibly the number one cause of cancer. So we need antioxidants. So our body has an antioxidant system that it creates antioxidants through different metabolic pathways that breaks those oxidizing agents down ultimately to water, and you excrete them. So you get rid of oxidizing agents through antioxidants that your body makes. Probably the best known antioxidant would maybe be glutathione. It's considered the most potent intracellular antioxidant, and it's made in the mitochondria, and it is basically the cell's detox pathway. So the purpose of that is that negates oxidizing agents and helps protect you from the dangers of oxidizing agents. Well, then you would think, and we tend to fall into this when we learn about natural things. We fall into this trap that there's certain things that are all bad and certain things that are all good. But in truth, there's certain things that maybe are all bad, but most things don't fall into that category. Things in too high of concentration can be good or bad. So same thing with oxidizing agents. The truth is our body actually makes oxidizing agents, makes it for a purpose to kill pathogens. That's one way that we kill pathogens, is through oxidizing agents that our body creates. So our body's cell defense mechanism, one is to create oxidizing agents to kill a pathogen. And then your antioxidant system will break down that oxidizing agent that it made and get rid of it. And everything in our body is about balance. And that's what's important to understand. However, when we're dealing with a sickness, let's say we already have a diagnosis of cancer, cancer cells are already in a state of oxidative stress, and using oxidizing agents can help tip them over and kill a cancer cell. That's the whole reason why a person would do IV high doses of vitamin C. Again, food source vitamin C that you would eat in a normal diet is at a dose of vitamin C that would function as an antioxidant, which can protect you against cancer and things, protect you against environmental toxins. However, when I have cancer, it can be beneficial to use oxidizing agents to kill a cancer. So vitamin C at a high dose actually acts as an oxidizing agent. It's not antioxidant, protective against cancer anymore. It can help tip cancer cells over. And it has been shown that it's not, it protects healthy cells. So it doesn't cause cell damage to healthy cells, at least in all the studies that have proven. So nutritional substances used at a specific dosage function as an oxidizing agent to unhealthy cells and to bacteria and viruses, and then can help kill them directly as an oxidizing agent, and yet basically leaves healthy cells alone. So versus like chemotherapy is an oxidizing agent, which can tip cells, but it doesn't leave healthy cells alone. It can actually cause cancer in a healthy cell. So there's positives and negatives to chemotherapy. It's an oxidizing agent, therefore it can kill a cell that is closer or nearer its lethal dose of stress because of oxidizing agents already being, produced in that unhealthy cell, a cancer cell. So that using chemotherapy could tip that over and kill a cancer cell. However, chemotherapy doesn't spare healthy cells, whereas vitamin C high dose, vitamin E high dose, selenium high dose, melatonin high dose, and other high dose nutrients that act as oxidizing agents tend to spare healthy cells. So you get the benefits, quote unquote, of like chemotherapy, but you don't get the negatives of chemotherapy. So is anything can enhance that? I wouldn't say anything can enhance that, but the second part of the question, are there supplements that should be avoided? The answer to that is yes. So if a person is trying to treat cancer with chemotherapy, oxidizing agent, or high dose vitamin C or high dose melatonin or B17. There's a lot of natural alternative cancer therapies that are oxidative. That's how they work. Similar to chemotherapy, they're oxidative. So by all means, you would not take antioxidants while you're doing an oxidative therapy, whether it's chemo or high dose vitamin C IVs. So you would stay away from oxidative therapy. So typically, our cancer patients, we don't recommend antioxidants, rarely, unless they test for it, but we don't recommend them taking glutathione. We don't recommend them taking alpha lipoic acid and other antioxidants. So I would stay away. Are there supplements that should be avoided? Yes, it's antioxidants. So you should stay away from antioxidants, or you're really kind of negating the benefits that you're trying to achieve by doing the high dose vitamin C. I think I had this question a couple weeks ago. Dr. Connors, tell me about hydrogen water. Do you recommend it to people? I think hydrogen water has its benefits. It's not something that we recommend to people. When I think I mentioned this too, when it first was discovered, and increased hydrogenation of water can have benefits with, I think it really stimulates the mitochondria and helps stimulate antioxidants. In one sense, that sounds like a great idea, but for a cancer patient, I don't think that's a great idea for the thing that I just mentioned before. You don't want antioxidants. I don't remember. Quite honestly, I don't remember all the other information on hydrogen water. We just did not go down that pathway. Next question. I have heard that one should refrain from fermented foods if they have an autoimmune condition until their gut is in a healing state. I am especially interested because one of my autoimmunities is autoimmune atrophic gastritis, along with Hashimoto's. What's your intake, please? So fermented foods contain benefits. So they have a lot of probiotics. They have a lot of good bacteria that can aid our natural microbiota. So fermented foods are really great. So there's been crazes the last 10 years about fermenting your own foods, and it can be so good for you. The negative of fermented foods is they contain a lot of histamines. So histamines is an inflammatory product that could cause more inflammation to somebody whose gut is already inflamed. So yes, I would agree with your comment that fermented foods can cause more inflammation in somebody who already has inflammation in their gut. However, the caveat to that is everybody is different. So some people even with inflammation in their gut, fermented foods can help calm things down. So part of the problem is it just gets a little bit more complicated. So number one, if a person is fermenting from a food that they already have antibodies for that food, you could develop antibodies to a fermented food, especially if you have a damaged gut. So then you're going to have increased inflammation from that alone, not just the histamines. Number two, if a person, typically when a person has a damaged gut, we just think, we just need to heal the intestinal permeability issues, the leaky gut diagrams that show cells that are separated and then things are getting in between the cells. Well, it could get worse than that. You could have intestinal permeability that is transcellular, meaning that it's not paracellular. So typical leaky gut information that's out there, and the pictures that you see look, the cells are damaged and separated and things get between the cell. That's paracellular leaky gut or paracellular permeability. There's worse condition that's transcellular permeability, and in even a worse condition where now you have lipopolysaccharides and antibodies to lipopolysaccharides, which is even worse. So there's different levels of intestinal permeability. And then there's also other comorbidities that go along with somebody that has gut damage? Does this person have ulcer issues? Does this person have B12 issues because they have, it all started with hypochlorhydria, decreased hydrochloric acid, and now they have a decrease in intrinsic factor production. So now they have B12 anemia. So there's other complications that go along with this. But in general, if a person is trying to heal a gut issue, and they're, well, I heard that kombucha is really good for you, so I'm going to start doing that, or fermented foods is really good for you. It depends on what food it is that is fermented. Let's say they eat pickles and they have no troubles, but they drink kombucha and it gives them this horrible gut pain. It really depends. Could they have antibodies to what was fermented in that particular kombucha? Yes. Could it be an irritation of the stomach because they have an ulcer that's causing them issues and that needs to be healed first? Yes. There's just a lot of different possibilities. It isn't always just that all fermented foods are on the no list, nor is it always that fermented foods are going to be a beneficial and increase healing. Typically, if a person has a really bad damaged gut, they should really do an intestinal permeability test. That's a Cyrex Array 2 to see what level of permeability that they have. Then looking for food sensitivities, because you may be eating foods that are causing inflammation. You may not actually feel that inflammation, but you're causing the inflammation in your gut that's causing this perpetual damage to the gut, and you're doing a bunch of good things to try to heal the gut, and it's not working. I've also had people come to me and they've done the food sensitivity testing and they're staying off of all these foods and they're on a very limited diet. They've never retested, but they have done very little to benefit in helping the gut heal. Therefore, you're only staying off those foods to stay away from inflammation, to be able to give yourself time to heal the gut so that you could go back and eat those foods. You don't want to stay on a very extremely restricted diet for a long period of time. That's not good for you either. So it gets complicated, but in general, I would say, if fermented foods are noticeably causing you issues, then and it's going to be different fermented foods for everybody, then you have to stay off those things. When you have an autoimmune disease, when I go into detail in the autoimmune course that I have, is that one of your main purposes in life to help manage an autoimmune disorder is to find triggers. And they change. So you're looking for things that trigger an immune response, that make you worse, that make you feel worse, that increase your symptoms, that increase objective findings, that maybe make your blood tests look worse, things like that. You're looking for triggers. And a lot of them are going to be things that you consume, foods. And they can change over time as well. But there's going to be other triggers, things in your environment, things you breathe in, molds, other things that you may have antibodies to, that you may have sensitivities to, that are going to stimulate an immune response and make you worse. So you got to find those triggers. They're going to be different for everybody with who has an autoimmune disease, and they change. Next question. I had a lumpectomy about 2 months ago. I am not doing radiation, and I am not taking an aromatase inhibitor medication. I will be ordering a Dutch test soon. Can you tell me which one I should choose? So Dutch test is a dried urine hormone test. Now there's a company called Precision Analytics that kind of really put Dutch tests on the map. So when most people say a Dutch test, they're talking about that laboratory. That's the laboratory we use, though there's other labs that do Dutch tests now, but we use Precision Diagnostics and it's called Dutch test. So they have a couple different ones. I typically recommend just the Dutch Complete, which includes the hormone testing, but it also includes the vials for testing your cortisol levels over time. So you get a nice look at your adrenal gland function, pituitary gland function as well. So the Dutch Complete, which is actually the less expensive one, because they have a Dutch Plus that has that, Plus, it has some other testing in that is kind of independent from hormones partially, but I would just do the Dutch Complete. And if a person has, so this person had lumpectomy, so meaning they had breast cancer, they did a lumpectomy, they're not doing radiation. So typically, if you have breast cancer, if there is an option for a lumpectomy, they're going to recommend lumpectomy plus doing radiation, followed by radiation, and many times then followed by chemotherapy. If you are ER, PR, or HER2 positive, they will typically recommend a medication that's called an aromatase inhibitor that basically blocks all your hormones completely. Now, a lot of women do not like to do that because it doesn't make them feel well. So different people have different symptoms with it, but especially if you're premenopausal, it's gonna put you into a chemically induced menopausal state. You're not going to feel very well. So a lot of women just don't like it. Maybe some of them start it because they're in fear, and then they start learning about it, and it makes them feel horrible. They start digging into some literature, and they just don't want to do this anymore. Now, there is some natural aromatase inhibitors that we use. Matter of fact, if you go to connorsclinic.com and you search aromatase, just type that in, you'll see multiple blog posts that I've written about natural aromatase inhibitors that a person could substitute. But I always recommend what this person is mentioning, and that is testing your hormones. Let's look at your levels. A lot of people have their estrogens in a very low range already. There isn't really a need to necessarily do any radical blockage of estrogens. So, I don't understand why an oncologist doesn't measure the hormones. I mean, I've never had a patient come in and say, my oncologist is going to do a hormone panel on me to see where my estrogens are at to decide whether I should do an aromatase inhibitor. No, they just don't. I mean, I'm sorry, but oncologists are like so many medical doctors out there. They're really not making decisions based upon clinical judgments. They're making decisions based upon the diagnosis, which that's the practice of medicine now. You are now just basically a technician of the pharmaceutical company. And once a diagnosis is rendered on that patient, then you have to follow, step 1, 2, 3, 4, 5, and make these recommendations, or your license is in jeopardy. It's unfortunate, but that's what it is now. So I think they should measure it. Let's look at it and see where your hormones are at. Maybe your 16-hydroxyestrone is really high. We need to lower that. Let's do this, that, or the other thing. And we're going to make that clinical decision based upon that data. But instead, they're just following orders of what they have to make recommendations of, or they're going to get in trouble based upon the diagnosis. And that's not really being a doctor. Okay, next question. What is the best blood level of vitamin D to shoot for? Well, that depends on what is going on. So remember, I have a video out there, the difference between lab ranges of not just vitamin D, but everything. Lab ranges and really functional ranges, or what could be called optimal ranges. So typically, they're different on most everything. They're different. So like a lab range, and understand, you're going to worry if you're going to go to Quest, or you go to LabCorp, or Access Medical, or a lab in a hospital, they're all going to be pretty similar, but they're going to be a little bit different. So it's just a number that has been, agreed upon, what was fairly normal. So vitamin D levels are going to be recommended at like 30 to 80 or something like that. If a person has cancer, I recommend a much higher vitamin D level. Try to maintain anywhere between 60 and 150. That's my recommendations. There really isn't, can you have too much vitamin D? Can you get to a toxic dose of vitamin D? I think you can get a toxic dose of anything. But you'd have to really be taking a lot of vitamin D to get to any toxic dose. I think there's some literature, there's some cases in the literature where a person had 400, value of vitamin D in their blood. Well, they must have been taking I don't know, a whole bottle of vitamin D every day in order to get to that. Usually the issue with vitamin D is it's too low. And the reason why a person can have vitamin D levels too low is, number one, maybe they just don't ever go outside. And their diet is void of good fats. Maybe they have serious fat absorption issues if they're on a medication that's blocking fat absorption. Vitamin D is a fat-soluble vitamin, so you need to be able to absorb it. If they have gallbladder issues, I mentioned that. Probably the most common reason for low vitamin D levels, though, is that they have genetic defects in the vitamin D receptors. So there's specific genes that are made to help you absorb vitamin D. And if you have a lot of defects in that, you're just going to have to take vitamin D at a higher dose than somebody who doesn't. So other things that could cause vitamin D low levels is a presence of an autoimmune disease. I mean, just from a clinical standpoint, when you see a low vitamin D, you need to start thinking about this person may have an autoimmune disease or some immune issue. Vitamin D, people think that vitamin D is an immune stimulator. Take vitamin D if you're feeling sick. Well, vitamin D is actually an immune regulator. So it stimulates Treg cells, which can help balance your immune system. So if your immune system is already suppressed because of a virus, it can help bring it up. So in that sense, yes, it helps stimulate your immune system. But if your immune system is hyperstimulated, in the case of a person with an autoimmune disease that is hyperinflamed because they're not dealing with the triggers, vitamin D can help calm that down. And many times a hidden or undiagnosed autoimmune disease is going to actually present with low vitamin D levels because that's actually what's taking place. Nobody diagnosed this person with an autoimmune disease, and they're using a lot of their vitamin D to help calm down an immune response on self-tissue. That just gives you clues to start looking for that. So how would you know you had autoimmune disease? You're testing for antibodies to self-tissue. Okay, that was the last question we had in for today. And I do have a patient visit here now. So we're going to have to call this at a half hour today. So reminding everybody to go to the holistichealthhour.com website where you can see all the past videos, all the past information, and nicely indexed, or go to connorsclinic.com if you want information, if you want to make an appointment with me. Everything is done over the phone or on Zoom. All right, welcome. Thank you, everybody, for coming, and we welcome your questions. So get your questions in from the Holistic Health Hour site. You can post your questions so that we can get them answered. Everybody have a blessed day. Bye-bye.